Action. We always knock before coming into the patient's room. And the next thing we do is foam in and out. So I'm going to use hand sanitizer today. I'm going to introduce myself to the patient. My name is Jessica. I'm going to be your nurse today. And then you identify the patient with 2 patient identifiers. So if you give me your first and last name and your date of birth.
Angel Wise, May 10th, 1992.
You're then going to explain your reason for being in the room and give a time duration about how long it's going to take. I'm here to give you a head-to-toe assessment. It should be no more than 20 minutes. Do you have any questions before we start?
No.
So the first thing that I'm going to do for the assessment is check her eyes. We're looking at the pupillary reflexes. We're going to have the patient look straight at your nose. You're going to shine the light into one eye, make sure the pupil contracts. You're going to shine the light in the same eye again and look at the other eye, make sure it contracts as well. Do the same thing on the other side. And she has perla, or she has, her pupils are equal and reactive to light. We're then going to check for accommodation. Have the patient look at the wall. You're going to bring your pen light close to the nose, have them focus on it. We're going to make sure the pupils are contracting and the eyes are focusing on the pen. So now we know she has perla. So pupils equal round reactive to light and accommodation. The next thing we're going to look at is her mouth. Open her up and say ah. Everything is pink and moist. When she says ah, her throat moves, so you know the vagus nerve is intact. Okay, the next thing we're going to do is make sure the patient knows you're going to touch them, especially around their throat. We're going to check to make sure the trachea is midline. We're going to make sure that this runs straight down the center of their body with no abnormalities. I like to check for lymph nodes if anything's swollen or inflamed. She seems to be doing okay. The next thing I like to move on to is going to be the lung sounds. Before I do that, I'm going to ask her about drainage. Do you have any drainage in your ears, eyes, or nose?
No.
Okay, so when we're listening to the breath sounds, we're comparing the right side to the left side. We're going to do 6 locations anteriorly and 6 locations posteriorly. We're going to start with the upper lobes. So I'm going to put my stethoscope here and have her take a deep breath in and out. I'm going to move to the other side, in between the intercostal spaces, another deep breath. Okay, and we're comparing right to left. I'm going to then move to the sides, so I get to the middle lobe, in and out. We're listening to the inspiration and the expiration for any differences or wheezes, rhonchi, anything like that. And lastly, we're going to move down to the bottom of the ribs, kind of tuck under there, and listen to the bottom lobes. Okay. We're going to move to the lung sounds on the back. We're going to start on one side next to the scapula, but not on the bone. Take a deep breath. And out. And then to the other side. We're going to go down to the middle lobe. Deep breath again. And then right on the bottom. Okay. She has clear and even lung sounds bilaterally. We're then going to listen to her heart. We're going to do this by finding her first rib on her right side. So collarbone, first rib, first intercostal space, second intercostal space. And right in that, in between the bones, we're going to then find S1 and S2 of the pulmonic valve. Once you've heard that for a few beats that are steady, you're going to move to the other side. Again, first rib, first intercostal space, second rib, second intercostal space. Place your stethoscope and listen for S1 and S2. Okay. After that, we're going to move down one more intercostal space to the tricuspid valve. Find S1, S2. I'm going to have her lay on her back and we're going to find the mitral valve and the apical pulse. So the mitral valve is going to be on the 5th intercostal space. So we're going to then count our ribs again. 1, 2, 3. Fingers out right here. 4, and then 5, and then we're going to come over to the side. And we're going to be right here. We're going to find the mitral valve S1 and S2. Once you can hear that, you can grab their arm and feel their radial pulse. Just keep their arm relaxed against their body or against the bed. And you're going to compare to make sure these things are in sync. If they're in sync for about 15 seconds, you can then stop. But if there's a deficit, you're going to hold it for a whole minute, count the difference, and then get a second nurse to confirm it with you. She doesn't have an apical pulse deficit, so we're going to move on. I don't have a blood pressure cuff, but at this point is when I would go ahead and do that. I would find the brachial artery, put the cuff on, pump it up to 180 or so, release it, and then find her blood pressure. I would count her and go ahead and count her radial pulse though. So I'm going to do that now. We're just going to find the pulse spot. We're going to count her beats. 6, 7, for about 15 seconds. Which was 17, so I'm going to do 17 times 4 because there's 4 intervals of 15 seconds, and that'll give me her heart rate. I'll do that later, but that's what I would notate. I would also take her temperature either through her forehead or her orally. Again, I run a thermometer, and along with the pulse ox as well. You just want to get a good run on the vital signs. But again, I don't have that equipment in quarantine, so we're going to move on. I'm going to ask the patient if it's okay if I lift up her shirt so that I can view her abdomen. Before we touch anything or oscillate to her abdomen, we're going to look for any kind of pulses or anything that's abnormal about the stomach. If there's anything like that, we don't want to press on it and rupture an aneurysm or anything. She seemed to look good, so we're going to then listen to her bowel sounds. At this point, I would also ask the patient about their last bowel movement.
This morning,
Color and consistency.
normal, brown, normal consistency.
Okay, and then I'm also going to ask about the last time you urinated.
This morning at the same time.
And then color and if it was cloudy.
Not cloudy, light to medium yellow color.
Okay. So since those things are consistent to normal daily life, we're just going to kind of move on. We're going to listen to the bowel sounds in all 4 quadrants. I try to follow a pattern of which the bowels move. So we're going to start up here, and we're going to listen for just the normal gurgling of the stomach. She hasn't had breakfast yet, so she's probably not going to be hyperactive in digesting food. We're just going to kind of hold it for a little bit until we hear normal active bowel sounds. So we're going to move to this quadrant. Same thing, so we're going to move to the lower quadrant and the 4th quadrant. And again, she's got normal active bowel sounds in all 4 quadrants, so you can document that. We're then going to palpate the abdomen, so I'm going to let the patient know I'm going to touch your stomach now. Let me know if anything is tender or hurts at all. So again, we're going to start and we're going to move across the stomach. We're going to feel for any distension of the bladder, distension of the abdomen, any kind of lumps or masses. She has I can document a soft, non-tender abdomen. I can put her shirt down. And then if you'll scoot up on the bed to me, we're going to move down the body. So here, she's got these tight leggings on, but if she was a normal hospital patient, she'd have a gown on, and you'd be able to view the calves. You're going to look for any kind of redness or discoloration. You're going to look for edema. You're going to touch the backs of the calves. You're going to feel if there's any swelling, any heat, or anything coming off the thing, off her calves, because you're looking for DVTs or any kind of peripheral vein disease. You're going to ask the patient about any pain in her calves, any tenderness when walking.
No.
And see if it's relieved by any kind of exercises. So from there, we're going to move on to her her feet. We're going to check for the dorsalis pulse on the top. I like to find 1 first, and then compare it to a second. And then you're going to be able to tell if how strong the pulse is. If it's bounding, it's 3. If it's normal, it's 2. And if it's thready, it's 1. So she has 2+ bilateral dorsalis pulses. We're going to move back here to the posterior tibial pulse. Again, I like to find one and then find the other. And she has, again, 2+ bilateral pulses. I'm then going to check capillary refill. Since her toes are painted, we're just going to squeeze the top of her toe red and make sure it goes away within 3 seconds. 1, 2. So she's less than 2, so we have bilateral cap refills on the toes. We're going to move to the hands. We're going to check her capillary refills there. She doesn't have polish here, so we can just squeeze and check the nail beds on both sides. I'm going to check her pulses on both sides. So again, bilateral cap refills less than 2 seconds, bilateral 2+ radial pulses. She's getting circulation to her entire body. The next thing on the list is going to be to have her do range of motion exercises. I like to ask the patient to take her hands and bring them above their head. We're making sure that her shoulders have good range of motion and bring them back down. You can bend your hands to your shoulders. Her elbows are flexing and extending. We're going to wiggle our fingers and rotate our wrists. Everything's good there. If you could bring this leg up to your chest. Hip is good, knee bend, come back down. And this leg here, same. Come back down. We're going to have her feet push against my hands like you're slamming down on a gas pedal. Good job. And then pull them back up to your face. Good job. So we have plantar flexion and extension. And then the last thing is going to be to take your neck, which you can sit up at this point. We're going to check your range of motion of your neck. You can go side to side, chin down and up. When she looks up, I'm also checking for jugular vein distension, which she doesn't have. And then if you can just kind of round the room with it. No pain and tenderness in any of those activities?
No.
Okay, well then I believe that we're done. Through the examination, we made sure that there was no skin integrity. If she wasn't my friend on video, we would look at her bottom, but we're not going to do that. When we checked her back and did the lung sounds on the back, we made sure there was no skin lesions or breakdown there. But I think at this point we're good to go. I like to kind of just mentally run through my checklist and make sure I didn't forget anything, which I think we pretty much covered it all. I then ask the patient if she has any questions.
No.
We're going to leave the patient in the bed, comfortable on the lowest position with 2 side rails up and her call light within reach. And at that point, we're just going to foam out and leave and make sure we thank the patient for their time. So thank you for being my patient today.
You're welcome.
I appreciate it.